Because of how serious, now these allegations have damaged also the work that the MEC for Health, as the lead MEC, Dr. Masuku, has been doing. He has been leading our team in the province on this front very well. And I must say that I'm disappointed. At this point, I'm really, really disappointed to have an MEC who has been leading in this front very well, facing allegations that I can't ignore. This cannot be ignored by any serious government, nor can the ANC ignore, and the ANC itself has taken specific decisions. So we know, as a fact, as the Premier of Gauteng, I'm therefore giving MEC Masuku leave of absence. Initially for the next 4 weeks, we're hoping that all these investigations will be completed in this period, so that the full report of the Special Investigation Unit comes to the fore. And these many allegations that have been thrown his way, it is not advisable for him to be bedeviled by those, instead of focusing on the battle in our hands. And the battle in our hands is to save lives. There will be an acting MEC for Health. So before you ask me who, let me, for completeness, I have appointed MEC Jacob Mamabulo, who is the MEC currently of Transport, Public Transport Infrastructure, to be the acting MEC for Health. He will do his work in transport, and in the next 4 weeks at least, when we are doing all this work, this investigation, MEC Jacob Mamabulo will be the acting MEC also for the Department of Health. My heart is sore that MEC Masuku, who has been doing so well, and Dibuo, you are the one asking this question. I'm saying my heart is sore that MEC Masuku, who has been doing such good work in helping us to respond to COVID, faces these allegations. But we can't close our eyes to it. It does raise question marks on political leaders, on government work, and the right thing to do is what in this particular case, that the allegations are there. We want to move on. We want to continue the battle against COVID. He stepped aside through leave of absence. We will continue the fight. This team that you have from the advisory council in the province, the health and COVID advisory council, the health workers on the ground that I have seen, who are doing work, that battle, that struggle must continue. The struggle against COVID must continue. Yes, MEC Mamabulo is not a doctor, I've said that. He will never exactly fit in the same way. But what we need there is to give guidance to the team of experts. We've got lots of capable people in the Department of Health. There may be rogue elements, and that's the rogue elements through this clean-up of the investigation we want to root out. But there are a lot of good people in the institutions. Our health institutions, Gauteng has got some of the best brains about the health professionals. They are there. They are in the front line of the battle. So if you ask me, it's a setback as the Premier who has so much confidence in the MEC, but it is true, he must clear his name. We can't just sit here and say, no, what he is saying is true. I may believe him, but there must be somebody who can say, hey, you might have not done something, but did other things happen in your name? That's why it's a very important step as a leader. Take a step back. He has taken a step back, but the battle continues.